Hello, this is Melissa Cutchell, and I will be talking about the community and public health roles and responsibilities. First of all, public health has an obligation and a responsibility to create a healthy population. That is their goal. The first question we can ask ourselves is, what is well-being? A general description for well-being is the welfare or wellness of an individual or group of people, such as a community or society overall. Well-being looks at the overall outcome in a social, economic, psychological, spiritual, or medical state. Good living conditions, such as housing and employment, are fundamental to well-being. So tracking living conditions. It is important to track these conditions for public policy. There are many indicators that measure living conditions. Well-being can provide a common metric that can help policymakers shape and compare the effects of different policies. So measuring, tracking, and promoting well-being can be useful for multiple stakeholders involved in disease and prevention and health promotion. Why is well-being useful for public health? Well-being integrates mental health, which is the mind, and physical health, which is the body, resulting in a more holistic approach to disease prevention and health promotion. Well-being is a valid population outcome measure beyond morbidity, mortality, and economic status that tells us how people perceive their life is going from their own perspective. Well-being is an outcome that is meaningful to the public, and also it is associated with numerous health, job, family, and economically related benefits. For example, higher levels of well-being are associated with decreased risk of disease, illness, and injury, better immune functioning, speedier recovery, and increased longevity. Individuals with high levels of well-being are more productive at work and are more likely to contribute to their communities. So the role of the community and public health. Public health tracks and investigates health problems in the community, prepares and responds to public health emergencies, develop, apply, and enforce policy, laws, regulations that promote health, promote disease prevention, link people to health services, and they continuously gain education on innovative health practices, health education, and keep up to date on services for the community, outbreaks, and living conditions. All of these roles that public health takes on are essential in promoting well-being in a community and individually. Quality health leads to positive well-being. So the CDC also is huge in preventing and creating a healthy population. The CDC has health-related quality of life program that has led an effort since 2007 to examine how well-being can be integrated into health promotion and how it can be measured in public health surveillance systems. The CDC also is leading the development of overarching goals related to quality of life and well-being for the Healthy People 2020 initiative, which is awesome. The 10 essential public health services framework are very important and a foundation for what public health stands for. So first off, monitoring the health status to identify and solve community health problems, diagnose and investigate health problems and health hazards in the community, inform, educate, and empower people about health issues, mobilize community partnerships and action to identify and solve health problems, develop policies and plans that support individual and community health efforts, enforce laws and regulations that protect health and ensure safety, link people to needed personal health services to ensure the provision of health care when otherwise unavailable, ensure competent public and personnel health workforce, evaluate effectiveness, accessibility, and the quality of personal and population-based health services, and lastly, research for new insights and innovative solutions to health problems. So those are the essential public health services that are involved in implementing public health and what they're all about. So the public health organizational structure deals with federal, state, and local agencies. So I'm just going to describe each agency and kind of what their role is. The Department of Homeland Security, which is also known as DHS, they were created in response to the terrorist attacks on September 11, 2001. It was designed to provide stronger protections from the domestic and international terrorism. The primary mission is to protect the American homeland. Looking at this from a public health perspective, this promotes improved emergency preparedness and cooperation with all levels of government. The DHS is made up of 23 different agencies, and they all play a key role in our society's health and safety. FEMA is the Federal Emergency Management Agency, and their mission is to support the citizens and first responders to ensure that the nation works together under any circumstance. The main role of FEMA is to coordinate preparedness, response, and recovery. FEMA dispatches the protocol in each particular emergency situation. The CDC, which is the Center for Disease Control, works with FEMA to assist with disasters. The CDC deals with health outbreaks, health emergencies, disease protection or prevention, and provides an abundance of resources. Under the direction of the CDC, the Office of Public Health Preparedness and Response provides a strategic direction and organization of efforts to prepare and respond to crisis. The major prevention method this agency is in charge of is the making of the flu vaccine, making sure it's available and effective for the upcoming flu season. The Health Resources and Service Administration's main function in the event of a disaster is to distribute grants to the presidentially declared disaster areas. The FDA, also known as the Food and Drug Administration, oversees the development of the human and veterinary products, as well as monitoring the food and blood supplies for the United States. The National Institute of Health comprised of 27 institutes and centers, each focused on a different aspect of health research. Each agency has its own focal point in the event of a disaster. The FBI is the Federal Bureau of Investigation, and it's the federal agency that is pretty much the front line of personnel in all terrorist attacks. Its employees are the ones who investigate acts and potential acts of terror. The Bureau comprises multiple operations, including Joint Terrorism Task Force, the Terrorist Screening Center, the Genocide War Crimes Program, the Weapons of Mass Destruction. It also operates numerous training programs, including the Hazardous Devices School, Resources for Law Enforcement, Canine Bomb Detection, and Improvised Explosives. Also, the local and state agencies are typically the ones to begin or trigger a response to whatever situation or issue is at the time. These agencies are separate, but they all work together for the health and wellness of our society. So when in public health, there are a lot of legal and ethical dimensions of community and public health that we need to look at. So the first thing is, what is the right thing to do is the question usually a lot of people ask themselves as public health providers and employees. When it comes to public health, there's an obligation to protect the public. So how can we do that with the legal and ethical approach? It's very difficult, but there are many questions you need to ask yourself. It may leave us questioning many situations and decisions, but we must remember the utmost important motivation is to protect the citizens to the best of our ability and scope of practice. So just a few ethical and legal issues I looked at. The vaccination requirements, so you have the issues between people wanting them and not wanting them, and then you have the bigger issue of protecting the public. Emerging infectious disease, so looking at the diseases that are emerging, that are starting to outbreak, and public health needs to stay on top of that, and so you have that legal issue if they don't, and something happens. The socioeconomic status in healthcare has to do with the health care as a right and health care as a privilege debate, and so you're looking at it as kind of an ethical dimension, whether all people deserve health care or just people who can afford it deserve it. So then you look at the professionalism and confidentiality. It's great to remain professional. You need to be professional in the field, and everything is confidential, and you need to know what you can share and what you can't. You also have an obligation to protect the public, so there's definitely fine lines there because you have to protect the public, but yet you do have people's personal opinions, and sometimes with the whole vaccination debate again, that may put the public at risk, but Are we taking away, is it an ethical thing to demand that everyone get vaccinated? And then you're looking at the issues if something does happen from a vaccine, that a parent didn't want to give their child or something, if a medical issue happens. So, and then overstepping boundaries, politics versus science, health and well-being. So, you have the laws and stuff, and then you have the science behind public health and the health and well-being, and sometimes those can conflict. So funding comes from the government and grants and the communities, taxpayers. There's a lot of planning and budgeting that goes into funding. And protecting the health and safety of Americans should be the top responsibility of our nation's leaders. But most of the time, this is a problem. Funding has always been an issue for public health. So this is definitely something that public health is always on top of, and finding new and innovative ways to help with the funding. Community is important. Communication in the community and public health programs is key. Obviously, getting the prevention awareness out there and what to do if something happens, and the education out there is huge. And educating and empowering the public to be healthier, live healthier lives, and advertising public health services so people are aware of what they can take advantage of and what they can take advantage of, benefit from, I should say, is a better word. So it's just getting the information out there and keeping the communication going, and keeping it organized. Again, you come back to the organizational structure of all those agencies, and in the event that an emergency happens, and knowing which direction to go and stuff. It's, communication is as in anything, it's essential. The components of successful public health implementation. So we're looking at things that make public health successful. Innovation, so being on top of the new technology, new medicines, new diseases, new approaches to use, the technical package. So you're looking at the technical part of public health, the technology, and working out the kinks and the issues. Effective performance of public health employees and providers, partnerships and coalitions with public and private sector organizations, which brings us back to the communication. Communication in the healthcare community also. Like I said, communication is linked to everything. And political commitment to obtain resources and support for effective action. So really, public health is all about the best interest of the society and keeping everyone healthy. So getting prevention awareness out there, and encouraging healthy diets, healthy exercise, discouraging, things such as drugs, alcohol, a sedentary lifestyle. So public health is really about getting the awareness out there and promoting a healthy community. So we need to get this into the schools and into the workplaces and just into the community in general. Public health has a very important job. Thank you.